Hi, I'm Dr. Kelly Kunkel, a plastic surgeon in Fort Worth, Texas. Today I wanted to talk about breast implant profiles. We hear a lot of questions when women come in for breast augmentation about what breast implant profile is going to work best for me. So I wanted to go over that for just a minute. If we look on this table, we'll see these are all 300cc Mentor silicone gel breast implants, but they're different profiles. This is a high profile breast implant, and as you can see, this is narrower than the moderate profile 300cc implant, and the moderate plus implant is in between. So we want to match the width of these implants to the width of that woman's breast. Now when we look at these implants from a different direction, when we look from this angle, you can see that the high profile implant stands out a little further from the chest. The moderate profile implant is a little flatter, and the moderate plus is kind of in between. So when we try to decide what implant to use and what profile to use, first thing I do is I measure how wide that woman's breasts are. And then what we'll do is listen to what she's looking for, try to match up the right volume implant and the right profile implant to get a look that's very much what she wants. So I want to look at this in a little different way. So let's take just a little salad plate. This inner diameter right here, that's about 13.5 centimeters, which is a little wider than the width of the average woman's breast. Now let's say that this is her breastbone and this is where her arm is over here. If we put this implant in, the high profile 300cc implant, and I put it as near to the breastbone as I can get it, look at all that space. That space out toward her arm, what would happen there is she'd lie down, the implant would slip out a little bit, she'd have a big gap between her breasts, so that's not going to be the right implant for her. Now let's take the moderate plus implant. We put that in, it's going to work better. There's still going to be a little bit of a space here, so when she lies down there'd still be more of a gap between her breasts. A moderate profile implant might work better. See how it fills up the width of that space real nicely. So this implant might work best for this woman depending on what she's really looking for. But that may not be the right implant for every woman. So for instance, what if we take somebody who's a little more petite? Let's take this little saucer. So somebody who's a little more petite, maybe 5 feet tall, 5 foot 1 inch tall, kind of 110 pounds or something. This is about 11 centimeters diameter. So let's take that implant we just used on the last one, we put it in there, it's going to overwhelm the width of that breast. It's going to give her that round headlight look. Most people do not want that. So what happens if we put in the moderate plus implant? It's going to work better, and it would actually probably work for her. Still might be a little too wide, but not too much really. And then what if we put in the higher profile implant? See, that's going to fill that space up almost perfectly. So we look at how wide the breast is. We look at how much tissue she already has. And we look at how stretchy that tissue is. If she's had 2 or 3 kids, that's different than if she's never had any children. So once I measure how wide the breasts are, then we kind of pick the breast implant profile based on all of these other things. So there's not a one-size-fits-all approach. We really try to match the right implant with the right patient. I'm Dr. Kelly Kunkel in Fort Worth. Thank you.